Welcome to the Screening for Suicide Risks module for Social Work 464, Understanding Suicide. My name is Laika Aguinaldo. I'm a PhD candidate in social work and a licensed independent clinical social worker. I am a psychiatry social work research fellow at Boston Children's Hospital, where I'm working on my dissertation focused on validating and exploring the psychometric properties of suicide risk screening instruments within primary care, a collaboration with the National Institute of Mental Health. I also work as the interventionist on Dr. O'Brien's research studies with suicidal teens. I am adjunct faculty at Simmons College as well as Boston University, and I am an associate at the Beck Group, the Center for Cognitive Behavioral Therapy. So within this online module, our learning objectives include 1, being able to describe suicide risk screening and differentiating suicide risk screening from a suicide risk assessment. Number 2, discuss validated instruments available for suicide risk screening. And number 3, if there's anything that I hope that you can remember from this brief online module, it is to ask suicide risk screening questions. I'm going to rely on the Mayo Clinic public service announcement to help with this. So suicide screening, what is it? By definition, suicide screening is a procedure in which a standardized instrument or protocol is used to identify individuals who may be at risk for suicide. How do you do it? The implementation can be done independently or as part of a more comprehensive health or behavioral health screening. It can also be done orally with the screener asking the questions with pencil and paper, or in some instances using a computer or even an iPad. Suicide assessment, what is it? By definition, suicide assessment is a comprehensive evaluation done by a clinician to confirm suspected suicide risk, estimate the immediate danger to the patient, and decide on a course of treatment. How do you do it? Suicide assessment implementation can involve structured questionnaires and open-ended conversation with a patient and her friends and family to gain insight into the patient's thoughts and behavior, as well as risk factors like access to lethal means or a history of suicide attempts, and protective factors like immediate family support, in addition to medical and mental health history. So the first screening instrument that I would like to discuss is called the ASQ, the Ask Suicide Screening Questions, which was created by Dr. Horowitz, who is a psychologist in the National Institute of Mental Health, Office of the Clinical Director. She basically led an interprofessional study team that included psychologists, psychiatry, epidemiologists, as well as social work. And they came together and brought about this instrument, which includes 4 items, which are yes or no responses. The administration time is less than or equal to 2 minutes, with a scoring time of less than or equal to 1 minute. This specific instrument has been validated within an adult inpatient setting as well as pediatric emergency departments, and is currently being validated in pediatric inpatient setting as well as outpatient settings like primary care. The instrument is available free for download in the public domain, and it was actually designed to be administered and scored and interpreted by non-mental health professionals. So this is what the Ask Suicide Screening Questions instrument looks like. The first item on the questionnaire includes the question, in the past few weeks, have you wished you were dead? Yes or no. Number 2, in the past few weeks, have you felt that you or your family would be better off if you were dead? Yes or no. Number 3, in the past week, have you been having thoughts about killing yourself? Yes or no. And number 4, have you ever tried to kill yourself? Yes or no. And if the answer is yes, then you would ask how and when. Now, if the patient answers yes to any of the above questions, you would determine the acuity by asking this 5th question, which is, are you having thoughts of killing yourself right now? So then you would put the response yes or no. The second screening instrument that I would like to discuss is called the SIQ, or the SIQ Junior, which was made by Dr. Reynolds. It's known as the Suicidal Ideation Questionnaire. It actually has 3 different adaptations. The first adaptation is a 25-item adaptation for adults, obviously older than, equal to, or older than 18 years old. And then another adaptation is a 30-item questionnaire, which is called the SIQ. It's for ages 12 to 18. And then there's a 15-item adaptation known as the SIQ Junior for ages 10 to 14. Basically, some of the underlying constructs within this instrument include questions around wishing to be dead, methods like if there's a specific plan or intent to act, and behavior like preparing to end your life, and it's basically on a Likert scale, so that's what makes it different. The administration time is 10 minutes, scoring time is within 5 to 10 minutes. It's available in 2 country-specific languages, and is available in the private domain. A pack of 25 instruments cost about $62. It's been validated with college students as well as adolescent suicide attempters, depressed adolescents, adults in the emergency department for psychiatric reasons, as well as adult psychiatric inpatients and outpatients. Now, this specific instrument was designed to be administered, scored, and interpreted by mental health professionals. The third screening instrument that I wanted to discuss is the C-SSRS, which was created by Dr. Posner. It's the Columbia Suicide Severity Rating Scale. So this specific questionnaire has 6 items, includes constructs of wish to be dead, method like a specific plan or intent to act, and behavior like preparing to end your life. And the responses on this specific questionnaire are, again, yes or no. So this specific questionnaire is available in 114 country-specific languages, has been validated with adolescent suicide attempters, depressed adolescents, adults in the emergency department for psychiatric reasons, as well as adult psychiatric inpatients. This specific instrument, the C-SSRS, is available in the public domain, free for download. Now, this specific instrument, mental health training is not required to administer. So, similar to the ASQ, various professionals can administer this scale, including physicians, nurses, psychologists, social workers, peer counselors, coordinators, researchers, teachers, and clergy. So this is the actual C-SSRS, and so you'll notice that the questions include: have you wished you were dead or wished you could go to sleep and not wake up? Yes or no. Number 2 is: have you actually had any thoughts of killing yourself? Yes or no. Have you been thinking about how you might kill yourself? Yes or no. Have you had these thoughts and had some intention of acting on them? Yes or no. Have you started to work out or worked out the details of how to kill yourself? Do you intend to carry out this plan? Yes or no. And number 6 is, have you ever done anything, started to do anything, or prepared to do anything to end your life? Yes or no. So now we've completed basically 2 of the objectives today, which included 1, describe what suicide risk screening is and how it's implemented, as well as what a suicide assessment is and how it's implemented. Number 2, discuss validated instruments available for suicide risk screening. So I talked about the Ask Suicide Screening questions, the Suicide Ideation Questionnaire, which is actually considered the gold standard right now, and the Columbia Suicide Severity Rating Scale. So now the take-home message is to ask suicide risk screening questions, which we will reiterate with the Mayo Clinic public service announcement.
I have my ups and downs, just like anybody else.
Maybe more than anybody else.
I can be hard to figure out.
And I like my privacy. I don't want you looking over my shoulder all the time.
But you know your kid better than anybody else. And if you think he's acting different than usual...
Acting really down? Crying all the time for no good reason?
Or getting really mad.
Not able to sleep, or sleeping too much.
Shutting her friends out or giving her stuff away.
Acting reckless. Drinking, using drugs. Staying out late.
Suddenly not doing stuff he used to love.
Or doing stuff that's just not like him.
It might be nothing to worry about. It might just be high school.
Or it might be something more. He might be depressed.
Not just feeling down. Really depressed.
It might be that your kid is thinking about killing himself.
It happens. More than you think. More than it should.
And people say, I had no idea.
I thought it was just a phase he was going through.
I never thought she'd do it.
I wish he'd come to me.
I wish he'd said
I
something.
wish I'd said something.
When it's too late. So if you think your kid's acting different, if she seems like a different person, say something.
Say, what's wrong? How can I help?
And ask straight out. Are you thinking about killing yourself?
It doesn't hurt to ask. In fact, it helps.
When people are thinking about killing themselves, they want somebody to ask.
They want somebody to care.
Maybe you're afraid you'll make it worse if you ask. Like, you'll put the idea in their head.
Believe me, it doesn't work that way.
It doesn't hurt to ask.
In fact, the best way to keep a teenager from killing herself is to ask, are you thinking about killing yourself?
And what if they say yes?
Or maybe.
Or sometimes,
Well, here's what you don't say.
That's crazy.
Don't be such a drama queen.
you're making too much of this.
That boy's not worth killing
yourself over. That's not going to solve anything.
You're just trying to get attention.
You're not going to kill yourself.
What you do say is,
I'm sorry you're feeling so bad.
How can I help?
We'll get through this together.
Let's keep you safe.
A lot of people think about killing themselves. Adults and kids.
most of them never try it, but some of them do. So if your kid says,
I'd be better off dead. I can't live with
I'm
this.
gonna kill myself,
Take her seriously. Find someone she can talk to about it. Someone who knows how to help.
Sometimes kids want to kill themselves because something happened. A breakup, a failure.
But sometimes it goes deeper, and it's not going to go away by itself.
Get some help. Talk to your doctor.
Or a counselor at school.
Or your minister.
but don't just let it drop.
And make sure that your kid always has someone to turn to. Someone he trusts.
Make a list together, right then. 3, 4, 5 names.
Put a suicide hotline number on there too.
Have him keep that list in his wallet, so he always knows where to turn.
Make sure your home is safe. If you have pills she could use to hurt herself, lock them up.
If you have a gun, don't just lock it up. Get it out of the house. The bullets, too.
And one more thing. If you think your kid might be about to hurt himself, don't leave him alone.
Take him to the emergency room.
Call 911 if you have to.
We all have our ups and downs, but sometimes it's more than that.
If you think something's wrong, the only way to find out is to ask. Ask straight out. Are you thinking about killing yourself?
Don't wait until you're sure. Trust your gut.
Because it never hurts to ask.
And it can make a big difference.
All the difference. In your kid's life.
So, to continue this take-home message of asking about suicide risks, we're going to continue this conversation in class lecture, which will include clinical tips for screening as well as a diet practice of the mentioned instruments. So, I look forward to meeting all of you and continuing our work in the classroom. Thank you again for viewing this module on suicide risk screening.